Welcome to this educational program. This module provides an overview of wet age-related macular degeneration, or wet AMD for short. There are other modules available that describe other aspects of AMD. This information is taken from a recent review of the medical literature and attempts to be as transparent and comprehensive as possible. However, it may not necessarily reflect the experience of your surgeon or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Any mention of drugs or medical products does not necessarily imply their endorsement. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. Age-related macular degeneration, or AMD, is an eye disease that may cause central vision loss. It affects the macula, the center of the retina at the back of the eye. There are two types of AMD: dry AMD, or early stage, and wet AMD, or advanced stage. Over time, dry AMD can progress to wet AMD, causing significant vision loss. Regular eye exams can help to prevent or delay this progression. The wet or advanced form of AMD is less common, accounting only for about 10% of cases, but it is more damaging. Wet AMD can develop rapidly and cause severe vision loss. Wet AMD involves the development of new blood vessels at the back of the eye that can rupture and bleed. This bleeding is actually accompanied by vision loss. During an eye exam, pictures can be taken of these blood vessels that allow the doctor to see the source of bleeding. Patients usually have multiple episodes of new blood vessel formation, resulting in several episodes of bleeding. Interestingly, there is no pain associated with this process. The delicate tissue of the retina at the back of the eye is normally separated and protected from nearby blood vessels by Bruch's membrane. In wet AMD, however, Bruch's membrane degenerates so much that blood vessels can push their way through the membrane into the retina. These blood vessels are abnormally weak and prone to leaking. As the blood vessels leak their contents, vision is lost. Eventually, scar tissue will form, permanently damaging the eye. Scar tissue formed at the back of the eye can cause you to see a dark spot in your center of vision called a scotoma. Your vision may be blurred, and you may also notice that straight objects appear bent or wavy. You may have decreased contrast sensitivity, the ability to distinguish light from dark, and you may also notice some loss of color perception. If your doctor suspects you might have wet AMD, he or she will likely refer you to a retinal specialist, a doctor who deals specifically with the retina and the macula at the back of the eye. This specialist may perform a Fluorescein Angiogram to determine the type and stage of AMD you have. During the Fluorescein Angiogram, a dye is injected into your arm. The dye will circulate in your bloodstream, making the tiny blood vessels in the eye easier to see. The doctor will be looking for signs of bleeding, which indicates wet AMD. The retinal specialist will advise you and offer treatment as appropriate. You will likely return to your regular eye doctor for regular checkups afterwards. Wet AMD can be classified by its location or pattern, as shown by the Fluorescein Angiogram. Your doctor may say that you have subfoveal, juxtafoveal, or extrafoveal wet AMD. He or she may also call it classic, occult, mixed, or recurrent. Some types of wet AMD respond to treatment better than others. Therefore, your retinal specialist will advise you on what particular type of treatment is most appropriate for you. Another imaging procedure a doctor may use is called Optical Coherence Tomography, or OCT for short. OCT uses infrared light to create high-resolution color images of the eye. Specialists use these images to analyze individual layers of the retina and measure the thickness of the macula. The test takes about 10 to 20 minutes and usually requires your pupils to be dilated with eye drops. Of the various treatments for wet AMD, the two preferred treatments are photodynamic therapy, or PDT, and anti-angiogenesis. Both treatments have been clinically tested and proven to be effective and safe. Other therapies include those that are currently being tested, some that are just starting to be explored, some that are inconclusive, and some that are outdated. Which treatment recommended to you will depend largely on the type, stage, and location of your AMD. Other modules in this series include Understanding AMD, Lowering the Risk of Developing AMD, Dry AMD, and Treatment of AMD. There are numerous resources to educate you and help you cope with AMD. Here are a few of them. AMD Canada, the American Academy of Ophthalmology, the Canadian Ophthalmological Society, the Canadian Association of Optometrists, the National Coalition for Vision Health, the Eye Club, and the Canadian National Institute for the Blind. Here are some more references that you may find useful. We hope that this program has furthered your understanding of wet AMD. We wish you the best for the future, and thank you once again for viewing this educational program.